This program was made possible by grants from the John and Diane Laxmi Family Charitable Fund, the Asfar and Maheen Malik Family Foundation, and the Missouri Asian American Youth Foundation.
The perception is that is something that is in your head and you can overcome it just by being strong and thinking through it.
Hi, I'm Aisha Sultan, and these are things we don't talk about. Sarah's a 40-year-old marketing professional, and she grapples with anxiety that affects every aspect of her life. It began subtly. She worries about work deadlines, social interactions, and even mundane things like waking up on time in the morning. Over time, her apprehension has gotten worse, affecting her sleep and appetite. Her mind races with what-if scenarios, imagining worst-case outcomes. She experiences heart palpitations, shortness of breath, and stomach aches. In some situations, her palms get sweaty, and she talks faster than usual. Minor setbacks can feel like disasters. She's afraid of failing. Meetings can trigger feelings of panic. It feels easier to withdraw from some social situations. She considers talking to someone, but she's worried that it won't make any difference. I'm joined by child psychiatrist Dr. Afshan Sultana and Alex Davis, a psychiatric mental health nurse practitioner, to help us better understand this hypothetical situation. Thank you both for joining me to talk about this really important issue. So first of all, isn't anxiety normal?
Thank you, Aisha. Thank you for choosing this topic of anxiety, which is very common throughout the world. It's the most common cause of mental misery in the world. Yes, anxiety is a normal emotion, just like we can be happy, sad, nervous. So anxiety is a normal phenomena. Sometimes it could be life-saving. If you have a snake in front of you, you would have the fear and leave response, and that is needed for your survival. So it is a normal emotion. The time it becomes abnormal is when it is so severe, it's affecting your daily life, your work, your relationships. That's when we feel that patient needs help.
When do you see patients come to you presenting with anxiety that's affecting their life? What does that look like?
Yeah, great question. I see it often in my practice, and it can present in many different ways. They can come and state that they're having trouble with their work, or they're having struggles with their relationships. And as we explore, we begin to discover a little bit of maybe avoidance or of withdrawn feelings with anxiety.
So how can you tell that you should talk to someone about this?
So it's a very good question. I would like to talk a little bit about that most commonly people do not seek attention for their problems. Why? Because of the stigma surrounding mental illness. People feel most of the time my patients present, and that's a very common comment that they pass, is I can tough it up.
Where does that feeling come from, that I can tough it out, I don't need to talk to someone? Why do we think that?
Because of the lack of understanding about mental health issues, there's a lot of misinformation and ignorance around mental health issues. So it's normal when we don't understand something, we'll be worried about it and we wouldn't want to do it, right? So that's why I think there is a reluctance in seeking help.
How do you explain anxiety to a patient who might just think, this is normal to feel this way?
Yeah, and anxiety can manifest in so many different ways, and that's something that I always try to express to my patients or my clients. So it can manifest in ways of checking your phone frequently or checking your email often. We sometimes think of anxiety as, rapid heart rate, rapid breathing, but it can manifest in so many ways, and exploring on why we're having that anxiety and those anxiety symptoms, I can better understand where the patient is coming from with their major concerns.
And how do you explain anxiety to patients?
So very important, I feel, that to clarify some misunderstandings.
Okay.
People think that it is something that's just in their head. And I want to help them understand that anxiety, when it's that frequent and is affecting your life, is actually a disease. So we should see psychiatric illnesses in a medical model, which means that our anxieties or depression they are biologically, there are biological factors that cause that anxiety in us. Our neurotransmitters, the chemicals in our brain, our genetics, neurophysiology, they're all involved in this disease presentation.
So there's something actually happening biologically with us if our anxiety is causing problems in our life.
Absolutely. So you should see it as hypertension is very common. Diabetes is very common.
Right.
When your doctor says you have high blood pressure, we'll start you on medications. You're not going to be worried about it. You will actually be expecting him to do something about it, right?
But when you tell a patient you have anxiety and I would like you to try this medicine, do you get pushback on that?
Yes, I definitely do. Reason being, again, people are worried about side effects. And of course, it's a chemical. It can have side effects. But of course, when you're talking to a professional, there are risk versus benefits that we check. And based on that, if it's a milder form of anxiety, we may refer them for cognitive behavioral therapy. We may not even want them to try medications. Most commonly, therapy and medication help the best, right?
And what about you? What do you say to patients who might be reluctant to consider medication?
Yeah, I find that if a patient is reluctant to start a medication, I just ask, what's your major concern? And sometimes understanding what their major concern is with that particular treatment, I can better inform, educate, or provide maybe even referrals.
What are the concerns you most commonly hear?
Yeah, side effects are definitely a most common one. If they really do need to take medication, why can't they just maybe stop feeling these anxious thoughts? And a lot of times it does go to that stigma with mental health. And I think with the stigma with mental health, one of the reasons why it is so pervasive is that we can't see it. We can't physically see it on somebody when someone is dealing with anxiety. And I think that is one of the major reasons for that stigma.
Right. I mean, it's easy to see if someone has a broken leg. It's harder to tell if somebody has a broken heart or something in their spirit is broken.
Absolutely. What Alex was talking about, for the most part, it's an overwhelm, it's a feeling inside, it's a mental anguish. But sometimes it will manifest in terms of panic attacks, which is a very physiological phenomena. Mm-hmm. Your heart beating, like in Sarah's case, in social situations, which I feel she may have social anxiety. In crowds or strangers, she'll start having those physical symptoms of palpitations, shortness of breath, nausea, all those symptoms. So it can be that.
Are there different types of anxiety?
There are a lot of different types of anxieties. We categorize them: social anxiety in social situations. There's performance anxiety on stage, and people need help with that. There is generalized anxiety, which is like the most common is generalized anxiety. The day-to-day, daily activities become overwhelming for them.
So how do you help patients overcome concerns that I might gain weight, I might not have the same level of desire as I had before, I might not feel like myself anymore if I take a medication?
Yeah, that is a question that I hear quite often. And I make sure that the treatment plan that I establish with a patient is individualized to what they want. So when we have follow-up appointments, I always say, if there's anything about this medicine, there's anything about this treatment that you are feeling is not helping or you don't like, it's not going to hurt my feelings. I want this to be a part of your decision-making. And usually working together in that collaborative practice can really help alleviate those concerns.
Dr. Sultana, are there some cultural stigmas that you are familiar with that make it harder for people to seek help for issues like anxiety?
Absolutely. In my practice, I see a variety of patients, different age groups as well. Very common, especially again in South Asian communities, because there is again, the perceptions, the perception is that is something that is in your head and you can overcome it just by being strong and thinking through it. So then, of course, the presentation of such patients is very late in the game, even for depression, when they have suffered enough and they feel like, no, something needs to happen. Mm-hmm. So again, the stigma. The other thing with the medications, people sometimes feel reluctant to seek help is because they have this perception that they'll be dependent on it forever and ever. So it's not a true addiction dependency. I tell my patients, of course, if you're taking a medicine, it makes you feel better, normal, you're living a regular life, people want to continue. I don't have to tell them that please do continue. Sometimes people want to drop off of it. During that time, I monitor them. Okay, let's take you a break and see how you do. And sometimes they come back, and sometimes they have received cognitive therapy. It may be situational and they get over it and move past it.
And Alex, what about in situations like you? Have you experienced cultural barriers to getting help?
Yeah, and I would try to best understand what, again, those kind of cultural concerns are. So if it's regarding medication, a lot of times I hear about concerns with dependence. So if someone has, panic attacks or anxiety attacks, well, is this medicine going to make me dependent? Am I going to become a drug addict? And explaining the reasons for the medication and that there's oversight by a medical provider, it can help alleviate those concerns.
How can you distinguish whether a person has anxiety or depression?
Very good question. Again, very commonly, we call it comorbid. Anxiety and depression occur in a person very commonly together. Usually, in my experience, I think untreated anxiety for a long period would eventually turn into depression. The same neurotransmitters are involved. The basic difference is anxiety is more overwhelming, but there is a desire to seek fun and joyful activities.
Okay.
In depression, you don't feel like going out and enjoying. This person may want to, but because they're afraid they're going to have a panic attack, they would avoid. And so depression is more episodic in nature, which means that it'll come, it'll last, and it'll go away. And then another episode will happen after a few months or a couple of years. Whereas anxiety is a chronic condition. It continues and it waxes and wanes. So it goes on. If there's a stressor, it'll heighten up and then it'll calm down. So that's how I see anxiety and depression.
And how do you explain to patients the difference between depression and anxiety, and if they're not sure what it is that they have, Alex?
Yeah, and it's so hard to sometimes distinguish in between depression and anxiety because there's so many overlapping symptoms. I like to describe anxiety as the fear of the unknown, fear of the future. What are the possibilities in the future? In depression, a lot of times we see more of concerns about not feeling pleasure in life, feeling more sad, more withdrawn. And both of those can feed into each other.
That's really helpful. That's helpful to understand the difference, the subtle differences sometimes between the two. And tell me a little bit about things that people don't know about anxiety that you wish they had better understanding about.
Yeah, there's really treatments that are effective. And the more that there isn't treatment of anxiety, it just causes more and more frustration because it's how we cope with that anxiety is really one of the most important things. If we're coping in maybe not the best way, whether it be avoiding situations, that anxiety is just going to continue to bubble up until there possibly is an anxiety attack or a meltdown.
Yeah.
So I would say I want to start with it's a normal emotion, but if it is on a regular, ongoing basis causing overwhelm and the quality of life is affected, it's not that you really have to be suffering in panic attacks, you seek help. When your quality of life is affected, that you are too overwhelmed after work that you can't spend time with your kids, you don't want to spend time with your partner, then I think it is affecting your relationships now too, right? You're avoiding situations.
One thing I noticed as a journalist is I get exposed to a lot of hard stories, difficult stories, emotionally taxing stories. And when there's a big event going on, like the pandemic, that was so stressful, I'm hearing stories from people who are losing their loved ones, afraid of losing their lives. My own household, kids were not in school. My husband got sick. There was so much going on at that time, and I felt really anxious about it all the time. But then I also thought, everybody's anxious. People are dealing with a lot worse situations than me. Why do I have a right to go talk to someone or try to get treatment if I'm not as bad off as someone else? Is that something you ever encounter?
Yes, it's very common. In different conversations, I've heard that it's good to have gratitude. Gratitude is a very important, there could be a whole lecture about that, very important, but at the same time, not to minimize your own situation. Yes, there are people who are suffering much more than us. We're grateful we're not. But again, our problems are also important enough for us because it is affecting us. It is affecting the loved ones around us because of the anxiety that we have, right? So it's important to get help.
How do we convince communities that are reluctant to prioritize mental health treatment, even if it's for something that's so commonly talked about, anxiety, known, people have a cultural understanding of it, to prioritize mental health treatment? How do we convince them that this is something that is worth spending money on, taking time out of your schedule for?
Self-care, are we talking about self-care?
We're talking about actually seeking treatment and talking to someone.
So again, I would emphasize on that medical model.
Okay.
I would emphasize that it is a medical illness.
Right.
There's nothing you did to create it. There are genetics, maybe family members had it. You have biological factors. And then you have life. So definitely I will also emphasize that we cannot neglect the social aspects of it, the psychological aspects of anxiety. But there is a medical model, and the social psychological aspects can worsen or improve it.
So speaking of those other strategies, what are some strategies you can share with patients who might not want to even broach the topic of medication right now to help manage anxiety?
Yeah, they can always speak with religious believers or religious people of faith in their religion. They can always speak with loved ones, family. And I think it's really important to also nourish a environment where you can speak about your mental health in your home, whether it be expressing how you're feeling, expressing anger, frustration, and validating your loved ones and family members so that you're putting a label to those emotions so that we can better know what emotions we're experiencing and when to need to get help.
What kind of strategies do you teach people, like in an anxious moment? What can they do, like right then?
Yeah, a lot of times I ask, well, where are you feeling that emotion in your body right now? Are you feeling it in your chest? Are you feeling it in your hands? Are you feeling it in your knees? And sometimes doing that body scanning and kind of seeing where that tension is can help us really notice the physical symptoms. And then that can lead to more information.
And then what do you do once they tell you where they're feeling it? Then what happens?
I ask, well, what was happening immediately before that? And sometimes we can begin to identify what is causing some of those anxiety symptoms.
So a trigger.
Exactly.
And so then are people supposed to avoid those triggers or manage their response to them differently?
Depends on the trigger.
What would you say, Dr. Sultana?
Yes, there can be triggers, and of course they can be avoidable. So for that, you need reflection. So you need to reflect, what are the triggers that are causing me this? And in therapy, you can do that.
Alex, there's a lot of talk around mindfulness and how it can potentially help with anxiety. And there's so many apps for that type of work now. What exactly is mindfulness?
Yeah, mindfulness, at least how I conceptualize it, is just checking in with oneself, seeing how they're feeling at that time, and what emotions we're feeling, what are we feeling physically. And like you said, there's a bunch of applications out there that can send you notifications to remind you to check in with yourself.
And do you think it's helpful?
Oh yes, it's fantastic. I've had many patients tell me that it's been a game changer.
Wow. Tell me a little bit about the 3 R's.
Yes, the 3 R's, Aisha, are recognize, regroup, and redirect. So recognize what are the triggers or what's causing me anxiety, regroup yourself, and then remind yourself, these are my thoughts, and they might not be true, so fact check them. And then redirect yourself. So to get away from those thoughts, then, start doing something, engaging in something else that would redirect your thoughts or fact check.
So I'll give you an example. Sometimes if I'm expecting my, child, my teenager, to be home by a certain time, and they're running late. All of a sudden, my mind is like, oh, could there have been a car accident? Could they be in trouble? Do they need me? And then I start feeling tension inside my body, like, oh no, where are they? What's going on? So in a situation like that, what would you guys tell me to do?
Yeah, that's something that I hear quite often from my patients, very similar situations. And I always say, when you're experiencing those what if thoughts, I say, well, what if it's not? And kind of closing that loop. So what if my family member got in a car accident? I say, well, what if they didn't? And sometimes reframing that at that moment, it can take a lot of work and practice, but it really does help.
Okay. Dr. Sultana, how should I redirect and reflect in that situation so I don't feel panic building in my chest about where are they?
So find a calm place, quiet place if you can. If not, you're in the situation. Again, reflect that, okay, this may be causing the problem, because last time in your situation, the example you gave, last time my daughter was late, something bad happened.
Right.
So now, of course, I'm thinking the worst. But I haven't heard anything bad.
Yeah.
I can always call and check on her.
Yeah.
But I'm going to think about that. Maybe that's not the cause, and let me wait and see. And so let me redirect myself. If she doesn't show up by 10:30, I'll call her. But by that time, maybe it's my thoughts that are making me feel this way. So I'm going to watch TV, make my dinner.
So is it unhealthy for me if I don't receive a text back from a child, like away at college, and they don't respond to my text, they don't answer their phones, and a day goes by, 2 days go by, 3 days go by, and then it's like this heightened feeling of, are they mad at me? Are they skipping all their classes? I don't know what's going on. Is it the same thing where I just have to make myself calm down? Or give me some strategies on how to deal with a situation like that.
Sure. Well, they better call you.
At some point, eventually, they always do, right?
Yes. So again, you can think about it that way. Maybe having a conversation and set some parameters. If past 3 days you're not calling me back, I will get worried. I might show up to college. But before that, I'm going to, I'll call, just give me a text, everything's okay, busy, and I'll get it. But also working on your cognitions. That in college, you're busy, you have deadlines, you have tests, you have so many sleep deprivation. So you have to take into account. But a good communication beforehand can set those boundaries that this is the time to get worried about.
Yeah. What would you say, Alex?
Yeah, I agree with everything that she stated. I would say that as kind of our relationships change, especially with our children as they get older, just exploring our relationship and being like, hey, I'm worried about you and I don't hear from you for a couple of days. Can you at least reach out to mom or dad just every couple of days, because I haven't heard from you? And sometimes having that communication in itself can be therapeutic for both parties.
Right, and sometimes it might just be a once a week thing, just a check-in to know that everything's okay, I'm handling it, I'm just super busy right now.
And then the other thing you can do, so in terms of reflection, you can see, okay, I do that when my kid didn't call, but then I do that when my friend didn't text, but then I do that in other situations. So you can start reflecting that I have a pattern that when I don't hear back about something, or then I'm apprehensive, my brain starts thinking and going in the negative direction. I somehow end up think of the worst scenario.
Yeah.
So maybe this is not right. Maybe I should talk to someone.
Right. That is really helpful, because I think making a connection to why do I automatically jump to a worst case scenario? Oh, my friend hasn't texted me back. Maybe she's mad at me. Oh, my child hasn't picked up my call. Maybe they're skipping all their classes and out in a bender or something, right? So are some people wired to just be more anxious? I know that seems like a simple question, but are some people's brains just built that way?
It's a complex question. I will say that sometimes family obviously has a huge impact. So if we have a family member that has a history of anxiety that we're aware of in the family, it can be genetic. Also, early life events. So if we experience, any kind of trauma or any kind of experience when we're young where we feel threatened, that is something that's going to stick with us. So
interesting.
To answer your question, there are those that can be more prone to have anxiety, yes.
And Dr. Sultana, do you think that sometimes by talking about it in therapy or by taking medication, you've seen patients really change the quality of their life?
Absolutely. Why? Because if they have physical symptoms, panic attacks especially, response to medications the best.
Okay.
By taking medications and working in cognitive therapy, people should understand that when they are doing the therapy and medications, they're going to go back to how they used to be without this anxiety, how normal they were feeling, and their cognitive distortions, this suddenly thinking about things in a negative pattern, they improve as well with the therapy and medications.
Alex, do you see people improve? Because there can be this fear of failure, like we saw in Sarah's situation, that it's not going to help me or I'm going to do it wrong.
Yeah, and I've seen amazing success in my practice. I've seen clients really change their outlook. And even clients or patients coming into the office and seeing they're doing something for themselves to help with this anxiety. Because anxiety, again, is the fear of the unknown. And they're making an actionable plan where they're coming to see me or a counselor and they are actively treating their anxiety.
Wonderful. Thank you both for joining me to have this really important conversation about things that we don't talk about.
Because of the lack of understanding about mental health issues, there's a lot of misinformation and ignorance around mental health issues. So it's normal when we don't understand something, we'll be worried about it and we wouldn't want to do it, right? So that's why I think there is a reluctance in seeking help.